All right, I think we'll go ahead and get started. Thank you everyone for joining us for today's BeWell Lunch and Learn titled Supporting Transgender and Non-Binary Colleagues. We're very excited to have Mondero Latrez here to speak. Just a few items before we start. These Lunch and Learns are brought to you by Penn State Health Human Resources and their BeWell initiative, which is an initiative to enhance employee wellness across the system. We will be recording today's session and be placing it on the BeWell website, and you will also be receiving it in the follow-up email that will go out in the next few days. If you have any questions or comments, please utilize the Q&A or the chat box feature, and we will get to as many as time allows for at the end of the presentation. So with that, I'm excited to turn this over to Mondero to speak about supporting transgender and non-binary colleagues. Welcome, Mondero.
Well, thank you so very much, Angela, again, for having me here. And I am delighted to present to the team of Penn State Health. And so you all, I am, with that being said, it is so important that you know that this is being brought to you by your Support Link Employee Assistance Program. And so this is to really much help us become informed. I know that when we're talking about topics like gender and sexuality and preference and norming, right? It can be a lot to take in. And so here I just ask us all to come into this space as we're listening in, with an open mind. Have your questions ready for me at the end, because I'll be happy to engage you in as best I can, right? Around what can we do collectively to make sure that there's support in the workspace, and also to feel supported in the workspace, right? We want to make sure that we're responding to folks with empathy, but also that we're leading with empathy. So in this space of leading with empathy, it's important from both sides of the aisle that as we talk about intersexuality today, as we talk about what is gender and how do we norm it, that we're all approaching this thing with a sense of openness, ready to teach one another and then to forge a new narrative, a new meaning that is less harmful than what we've seen before. Because let's just face it, when we talk about supporting transgender and non-binary colleagues, there has been a ton of harm that has been done. And so my name is Mondero Latrez, and I am your facilitator for today. I traveled the country for about 7.5 years as a behaviorist, really supporting families with children of autism. And then I began to broaden that span by just focus on individuals, particularly children in school settings that struggled with behavioral issues. And what I soon learned was that the influences of environment, culture, ability, and class, choice, and necessity shaped our behaviors, right? And so with this in mind, I'd like to talk with you all about supporting transgender and non-binary colleagues, because what we may not be aware of is that we hold some sort of bias. And many of us do this unintentionally, myself included. And just to share in full transparency with you all, I am a member of the LGBTQIA+ community. And as such, I have found myself even harming the very people that I represent as well. And so it is a learned experience that I hope that we all can share in today so that we can better engage, right? And at all points, because I'm facilitating does not make me the end all be all of all the experiences, right? So feel free to chime in, right? Tell me, hey, Mondero, I want to push back on this thought a bit much, right? And I'm happy and I'm open to receive those things, because again, I want to lead by example, approaching with a sense of openness that we can all be heard, right? And so I'll leave with this before moving to the disclaimer. In all spaces, we all want to be one of three things. And either of these things could change at any moment in life, depending on where we are. We all want to be seen. We all desire to be heard. And we all desire to be felt. And so what I want you to walk away from with this presentation is, have I allowed someone else to be seen, heard, or felt? And I can assure you, because it's contagious, someone will allow you the same space. All right, so moving forward, a disclaimer, just a quick order of business as we get started. Here's a brief disclaimer, read verbatim. The general views, thoughts, and opinions expressed in this presentation are expressly those of the presenter. The presentation is intended to provide general tips, advice, and coping skills, and may not entirely pertain to your circumstance. or you as an individual in a professional or clinical capacity. For specific advice on your unique situation, please reach out to a licensed clinical professional for a confidential one-on-one consult. Notice I skipped over financial, it's not applicable here. CureLink Healthcare and the presenter are not held responsible or liable for any consequences or damages due to an individual taking action based on the information presented herein. All right, so some concepts that we're looking at, right, that we may not cover today, but I want you all to keep in mind is that the purpose of today's presentation is not to offer support or validate any ethical, moral, religious, or philosophical viewpoint on gender or gender identity. At no point will you be asked to change or defend your personal viewpoints. Rather, the purpose is to share data and offer practical tools to help create support and perpetuate inclusive systems so all members of those systems feel safe and can bring their very best selves to work. For many of us here, we'll find that this doesn't just extend to our colleagues, but also our family members, our friends, our patients, right? And I've worked in healthcare settings as well, so I totally understand the patient experience. So this, you'll find, is far reaching. You'll hear me refer to another analogy later in the presentation about reach, okay? All right, so the objective for today is really around making sure that we understand why support is important in the workplace, right? For those persons that are non-binary and intersex, why should we be supporting them? And we've known for such a long time that we want to support the status quo of, well, can't things just remain the same? Can't they just be what they've always been? And what that tells me is that I'm talking to a group of privileged individuals who have developed a sense of power dynamic. And for anyone, relinquishing and releasing power can be a challenge, right? When what has always existed has not harmed you, it is something that we want to hold on to. But we're going to discuss harm today. So we're going to talk about why it's important. The difference between gender identity and sexual orientation, because simply put, they're just not the same. The difference between gender and sex. And what is blah, 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 like what questions we want to have and fill in the blank around gender and sexual identity, right? And then the options for authenticity, like how can you allow someone to be themselves, showing up fully in the space of work as themselves without the judgment factor being in a space of concern for that person, right? So supporting your colleagues, and how can we best do that? And then supporting someone going through a transition, right? And that we'll talk about assignment, and then we'll get down to that a bit more. All right, so let's dive right in. All right, so what does support in the workplace actually look like? I mean, because we know that we're talking about it's just, it's personal, right? Some of the things are personal, but we also know that being supportive in the workplace is not just personal, right? It's about the person. And here we want to think about individuation, right? I want us to take some time to think about a person's lived experience. And then I want us to think about what are these universal norms that most of my clients will hear me say, and most anyone who sat under facilitation with me will hear me say, is individuation or individuality and a sense of individualism is important, right? So how can we begin to, under those universal norms, connect with someone, right? It's not just personal, it's about the person, like pain, loss, hope, excitement, grief. Those are all universal things that we understand. So how can we make that about the person themselves? And then work, right? And we know that work contributes to self-esteem, well-being, and identity. But I invite us to think of this as a sense of belonging, considering that we spend 8 to 12 hours a day with our colleagues, right? For those of us who are nurses in this space of facilitation, you're likely going to spend anywhere from 8 to 12 hours. Radiologists, et cetera, doctors, et cetera, you're going to spend a countless amount of hours, at least sometimes on a 2 to 3, 4-day stretch with your colleagues. This means, guys, that we have more exposure to our colleagues than we do our families. So we know that a large part of who we are is established and shaped by what we do, okay, and who we're doing it with. So feelings that, are unsafe. So feeling unsafe or restricted directly impacts trust, productivity, and commitment. And so we could get into, high turnover rates. We could get into toxic work environments, but I'm going to hold on those. I'm going to talk about, what impacts one individual impacts all individuals in the culture. And if you guys have ever watched, what was it? Drumline? It's a movie that I like, and Professor Lee said on the movie, one band, one sound, right? So if it impacts one of us, it impacts all of us. And in the words of Dr. Martin Luther King, he said, an injustice anywhere is a threat to justice everywhere. So it's only a matter of time if we stand silently for folks who are being oppressed by either our culture, our environment, our politics, our standards. It's going to make its way to our door. So how can we make sure that we're all progressing as one? And then we're talking about our corporate culture, right? Directly, and how it impacts culture outside of work. This is what I like to refer to as the invisible octopus. Its tentacles are far reaching, attaching itself to all spaces with the element of subtlety and surprise. I want to say that again, because this is corporate culture, right? It directly impacts culture outside of work, and it is invisible, right? With octopus-like tentacles that are far reaching, and its element is the subtlety of surprise, right? If you've ever watched an octopus, it attacks with subtlety, but before you know it, you're caught in its tentacles and you can't remove. That's how workplace culture is developed, right? We are in the spaces of our work, and the culture is developed, and before you know it, we are all a part of this embodying belief that has become normal, yet potentially harmful for someone else. Right? So we're going to talk about that today. So I want us to talk about, like, how can we support someone in the workplace that allows us to develop a new culture of sensitivity, right? Of cultural competence. So let's talk about what is gender identity. We often know gender identity and sexual orientation are, equated to be the same, but they're not. So the differences, as we break them down, it's really about who you are and who you are attracted to. So gender identity is defined as a personal conception of oneself as male or female, or rarely both or neither, right? And this concept is intimately related to the concept of gender roles, which is defined as the outward manifestations of personality that reflect the gender identity. Okay. And sexual orientation, however, is about who you're attracted to and who you feel drawn to emotionally, romantically, and sexually, right? It's different than gender identity. And gender identity isn't about who you're attracted to, but about who you are, right? This talks more about like male or female and gender queer. So gender identity is about who you're attracted to, right? But about who you are, male or female. So I can identify as one way, right? And then there's my sexual orientation, about whom I'm attracted to. They're totally different things, right? Who I'm attracted to and how I identify can be totally different. And so it's time that we stop lumping them together and become really clear that these two things can be different, and they are different, and it's okay. Okay. So let's see here. And so this means that being transgender, feeling like you're assigned sex at birth, is different from the gender you identify with. It isn't the same thing as being gay, lesbian, or bisexual. Sexual orientation really is more about who you want to be with, while gender identity is about who you are. Sexual orientation, who I want to be with. Sexual identity, who I am. I hope that is like very clear for all of us, just so we're very clear about that. And then we can begin to appreciate, because as we can appreciate definitions, if you're like me, I appreciate definitions. Sometimes definitions can be really boxing, right? They can really put us into this limited space. But I like definitions because it gives us a base from which to work and create, right? I have something, if you're a cook, you like to come in the kitchen and cook. If I have flour and sugar and eggs, I know that I can make pancakes, I can make a cake, I can make tortillas. I can do quite a few things with those elements. I have a good base. So that's why I like definitions, because it gives us a good base from which to start. But then there are times where we need to expand upon the base And that's why we're here today. We need to add a little shortening. We need to add a little water. We need to add a little extract because it becomes the recipe for what we need becomes a bit more complex. And so likewise, when we talk about identity, it's a bit more complex than presentation. And so we don't want to limit folks by how they present, but more like how they feel on the inside and what they tell you they identify as. Okay, so let's talk a little bit about gender and sex, right? So sex is typically categorized as male or female based on anatomy. We know this to be true, but I really want us to think about this. And I got an opportunity as we watched TED Talk with Susanna Timko, what it means to be intersex. And in this TED Talk, she really explored, how does it feel to be intersex? What does it mean to be intersex? And the difficulties having to subscribe to the social constructs of gender, all while living invisibly. She noted in this TED Talk that so much of her had to be a secret, right? And that from medical professionals and family alike, it was always this great burden to keep this secret of like, well, if I've been, because of the reassignment, I have to keep quiet. I can't tell anyone that my sex was assigned to me, right? And that I didn't get a choice. People shouldn't know this, right? But then there's great pain and great harm in that. We'll talk about that just a little bit down the line. And so in this space, as we talked about this, she talked about intersex by definition is a person born with reproductive or sexual anatomy that doesn't quite check the boxes of female or male. And to assign gender, some parents have sought to have assignment surgery. But when we get right down to the core of it, right, what we know is that this is an attempt to normalize the ambiguity that is presented in intersex individuals. That's that kind of complex space that we were talking about with the ingredients, right? I know I have flour and eggs and sugar, right? But then I need something else to make something else. And this is where folks get confused because what we're trying to do is we're saying, well, there's so much we can make. Why don't we just make this thing? Because this is what we know and this is what we're comfortable with. If I see eggs, I see flour, I see sugar, I'm only going to make this. And we're saying that human anatomy, human biological makeup is not that simple. It is not as simple as cake and flour and eggs and whatnot, right? This is complex and we need to allow room for that complexity, right? Oftentimes these gender assignments are performed in the spaces that Susanna talked about, without consent, because this is done pretty young, right? The surgeries are completed pretty young and without consent, and often they're asked not to share that surgery has been performed. And worth noting is that these assignments cannot be undone. These surgeries often result in lifelong medication reception with consistent pain, both emotional and physical in nature. And this being true, we're left with the question, is our definition of biological sex outdated? And can we embrace the complexity of gender that is also intersexed, right? Because gender is a social construct that aligns with expectations around our sex, according to physical sexual characteristics. If I'm male and I am born with an appendage, or I am presenting as male, then I cannot behave in any other space because that is the box that we've been limited to. And while yet I can appreciate the foundation, I can also appreciate, and I believe you can appreciate with education and information, the expansion of that definition, right? The expansion of what can be and what can exist with that space. We all can when we know better, right? And when we have more access to information. Okay, so what is this thing about transgender and non-binary and genderqueer and gender fluid and gender non-conforming, right? It's simply put, it's when a person's sense of self or gender expression does not match the sex they are assigned at birth, or their sense of self does not fit the standard binary female male definition. Right? So I want to say that again. What is this thing, right? It's basically when a person's sense of self, their gender expression, doesn't match their sex. their biological sex, right? And research suggests that children as young as 3 years old can have an awareness that their assigned gender does not match their sense of self. And we're seeing it more and more as the days go by. We're seeing children at 6 and 7 and 8 say that, although born male anatomically, biologically, they they don't feel like that. And if you guys have watched Grey's Anatomy, I absolutely love Grey's Anatomy, the most recent season. I tried to think of doctors' names and I forget at the moment, but anyway, and I should know their names as much as I love the show. But they have a son, and the son is now telling them, I think he's like 2 or 3 years old, three maybe a little older, 4, that he identifies as she. And the mom just basically loses it and reminds him quickly that he is not she, he is he, right? And in this space, she was demonstrating that she was unwilling to conform to his sense of identity. And could you imagine how harmful that is when you're being told at such an early age, you're not who you think you are, when we're raising children to be totally autonomous in the development of their identity, right? And so the harm that is done in that space is we, disallowing the space for the child to reveal who they are, right? And like so, this is what we're experiencing in our workplaces, is that we're not allowing the space for folks to be themselves and reveal to themselves, not to us, but to themselves who they are, while having our support, right? While demonstrating an understanding and a need to ask questions, leading with total empathy by asking tons of questions. And when you feel like there just isn't the right question, just kind of getting to the question or getting a question out so that you get to the right question may be the way. And so let's talk about, cisgender. So cisgender is heterosexual, and it simply means denoting or relating to a person whose sense of personal identity and gender responds with their birth sex, right? And so this is a female identifying as a female based upon her biological, or as some would say, anatomical makeup, a male doing the same. Well, when you're intersex, that could be a bit more different, right? Because there is the presentation for both. And so let's explore, just by definition, cis in Latin means on this side, while trans means on the other side. So cis or trans is answering if the gender you identify with is the one of the same side or not, as the gender you were assigned at birth, right? So transgender on the other side is saying that I identify as other than my assignment at birth, right? So this is how we can come up with transgendered female, transgendered male. I identify as something different than at birth. Okay. And so let's talk just a little bit about some of the facts, right? Because I know oftentimes when we get into the space and we're trying to say, well, this person chose this. They didn't have to be this way, right? To be transgendered, is a choice. To be, to be trans anything is a choice, because you could have chosen not to do that. You chose that, right? And what worth noting is that it's not a choice, right? As discussed earlier, sexual orientation and gender identity are different than other dimensions of diversity. And these factors often lead to the belief and perception that identity and orientation are, or at the very least, can be the result of choice. And we know that that's just not true. When this is combined with cultural norms, rules, and expectations, the fact that behavior is a choice, or the belief that being LGBTQ is a choice, is formed, reinforced, and then perpetuated, because that's a fact. But and the fact is that there is a belief that reinforces how we engage normalcy, right? And then when someone responds differently to normal, then we otherize that person, and it becomes very uncomfortable for them to exist and present themselves. I want to say this again, because oftentimes we look to do this external work, right, to someone else, but to present themselves to themselves and then to all of the world, to the rest of us to see. And the demonstration becomes murky because everything about me is telling me I can't be what I believe I am, right? It is not new or a trend. And why all of a sudden is everybody gay is questions that we hear all the time. It is not all of a sudden, right? Rather, our culture is changing where people are feeling safer to be able to be their authentic selves without fear of physical, psychological, social, legal, medical, or negative consequences. And even though I wrote this, I still don't know that that's altogether true, because in many spaces of culture, we see that there is still quite the challenge for folks to overcome negative stereotyping or consequences when they begin to live in their truth. So this isn't all of a sudden, right? We know that since the dawn of times, there has been this fluidity that existed in identity, this fluidity that existed in preference, but now it is a bit more safe. We can't say that it's absolutely safe, like where there's 100% concrete, there is safety, but there is a greater degree of social acceptance, of social embracing, right? And it is not about personality or quality of personhood, right? Orientation and identity are like many other dimensions of diversity that have nothing to do with personality or what type of person someone is. However, things like stereotypes, cultural tropes, and or unsubstantiated truths often lead to both individual and systemic beliefs about what type of human is the LGBTQ person. I'm sure if you're a part of the LGBTQ community here, you can identify with me when I say it has been thought that you're predators, right? Oh, they must be predators, that we're predators. And that could not be far from the truth. For me, very personal belief, if you harm children, I have a really hard time being able to work with someone who's harmed children. I remember while being in grad school, one of the things that we had to do, they said, counselor, know thyself, know that you cannot counsel yourself, and also know what are your triggers, right? I remember learning this in grad school as I was going to pursue my degree, right? And I remembered, pedophiles really trigger me. Won't get into the why of it, but pedophiles really trigger me. And I remember, once I identified as being a member of the LGBTQ, that was not something I wanted to be associated with. Yet, there was this space that, if you're LGBTQ, you're predatory in some way. You have reckless desires. Your sexual desires are uncontrollable, and you have a voracious appetite for sex, and all of those things could not be further from the truth. For example, all gays are effeminate, we know is not true, right? And this can be especially destructive when these beliefs are about the inherent value of quality of the person, right? There is the example again that we talked about for pedophiles, right? And while this is not unique in terms of dimension of diversity, the examples of ethnic or racial stereotypes, it can be magnified by the concepts described already in terms of things like the perception of choice. You chose this. You had to, right? There's no way. You chose this. And so then you embrace all that it comes with. And these are some of the biases that many of us carry with us unaware, right? We carry these things with us unaware until a situation presents itself. And now we're struggling on how to really support a colleague or a family member or a friend or a child, a loved one, because we were unaware that we had these biases, right? And that's why trainings like this, I believe, really is going to help change the trajectory of what the narrative can become in the days ahead. And children can feel gender dysphoria at an early age. Kids are too young to understand or know or figure out even things like gender identity or sexual orientation. And since this dimension of diversity is innate, inherent, versus learn, children have a true sense of orientation and identity from a very early age. And so research suggests that most children, really begin to categorize their gender by the age of 3. And that's notwithstanding all of what we do by gender norming or social norming. Girls wear pink, and you guys can finish the sentence. Boys wear, and I know you guys can't chime in, but I know many of you heard it in your head, right? As you listen. That tells you that we're socializing, and we're socializing, we're socializing, we're socializing norms around gender. So we know that this research, and I don't know that we had to do this. This is what I love to tell folks. Oftentimes, a lot of what we talk about in the spaces of, non-binary, transgender spaces, or LGBTQ, any of the spaces, right? The umbrella, I want to just group it all at once and know that there's separation. Is a lot of it is common sense. But we don't stop to think, how can this be applicable if we were in the situation? That's why you'll hear me say repeatedly throughout this presentation, just go back to empathy. How would I want to be treated? How would I want to be understood? And would I want to be heard, felt, or seen when what I'm presenting is different than what the rest of, or the majority of society, or the majority of my workspace, the majority of my family presents as? Okay. And so I'll leave you all with a resource here by the Mayo Clinic, and it is, for health in depth, children and gender identity. So you'll want to go to the Mayo Clinic, and you'll want to Google the article, children's health in depth, children and gender identity. And research also suggests that there is no measurable difference in the development timeline of awareness of sexual orientation, regardless of their orientation. What is different is a child's behavior and ability to comfortably identify themselves based on cultural influences. Example, being in the closet, right? How is it that we can see a 17 or 23, or even now, where we're seeing 60-year-old women and men live in their truth for the first time? And when someone asks them at 60 years old, when did you know? And they say, oh, I knew at 8. Oh, I knew at 9. And there was this space of living in the closet because that was around cultural influences, right? And social influences that taught them that this, and this being you, I want to be very clear, you are not okay to present in this manner. This version of you is not appreciated or accepted in this way. And so then we force this muting of identity. And so then it doesn't become lost on us as clinicians, like, why are we experiencing patients who have a challenge with being with a sense of self? Because they were never really allowed to express who they were, again, to themselves, and then present that to the rest of the world. That's us, that's you and I, right? And so gender and sexuality is on a continuum. And why do you keep adding all these letters, people say? And it's because identity and orientation is not binary. And as we are better able to linguistically identify where we as human beings are and where we fall on the continuum, we are better able to name and describe ourselves, right? And so we're thinking about this is like, oh, here is an opportunity for me to better identify. I'll give you great examples that are very, very simplistic, right? When you were 20, you identified that this was a certain thing about love that you loved about a boyfriend or a girlfriend or a partner of choice. Now fast forward at 30 and you ask yourself, do you like or identify the same things of love? And I can almost guarantee you 10 years removed, that's changed. That's where we are on the continuum of sexuality, right? What we were able to identify before, we may now recognize that we misidentified, and so it requires correction. We may also now be able to linguistically understand that there is an addition that needs to happen to practice inclusivity, so that all have an opportunity to be presented or represented, right? All meaning everyone, no one's left out. As I love to tell, my nephew, what can we exclude from all? And he loves to say, absolutely nothing, because then it wouldn't be all. It's the cutest thing. Okay, so let's talk a little bit about our authenticity and pronouns and name and gender identification. Like when we misgender, what does that look like, right? So there are several things someone that identifies with being on the LGBTQ spectrum can do to express the identity that they align with. And some of these really include like pronouns. I may say that I identify as she, her, right? That sends a signal to you that this is how I identify and this is how I choose to be addressed. I may change my name to become more that of a socially recognized name that is female, right? If I were looking to do that. And then in gender identification, I may very well say, okay, this is how I identify. And I'm going to also do some things like that become very visibly known that allows you to support my gender identity, right? Because this is what I'm feeling and this is my expression, all right? And so unfortunately, misgendering or using the wrong pronouns happens so frequently that it can be harmful. And it can also lead to a non-safe space. It is important to never assume someone's gender or pronouns and instead ask how they would like to be addressed. Gender expressions, hormones, or confirmation surgery is just a few things that allows someone to feel authentically like themselves. And it is your job to be an ally and supportive. Even if you may not agree due to personal or religious beliefs, it's your job to show respect and honor their wishes, calling them by their pronouns and they identify with, or even sometimes a new name to go with their identity is appreciated. I have a transgendered trans male friend of mine who I'm very, very close with. And this weekend, he experienced something that was very, very rough for him. And I'll share this with you all and then jump right off of it. But we really had to process it out. His brother refused. And I want to appeal to you all in terms of humanity, because it really agitated me. I'll be honest, it frustrated me. His brother, who is also military, they're out and he identifies as male now and presents as male and a male appearing. And so publicly, everyone who sees him engages him as male. Well, their waiter brought some food to him and his brother says, "Oh, her? That's my sister." The anguish with which he presented when he called me and the hurt and the alarm was just heartbreaking, because I could only think, does he realize he's putting you at risk, that there is still bigotry and that there is still hate, and there is a group of people allied together to cause harm to someone of the trans community because they believe it's false representation. It's ignorant and it's downright distasteful, right? And so for all of us, when I say that it is your job, I am using that expression very strongly because it is your job. It is your duty to protect someone under the bridle of human safety. You don't have to agree with it. You don't have to understand it even, I say it sometimes, but it is important that you respect it and protect the safety of each human, because we're all caught up in this inescapable network of mutuality that is human. We all want to feel safe. And according to Maslow's hierarchy of needs, that's at the pinnacle, right? We all want to feel safe. And in our workspaces, we should certainly feel safe. In our home spaces, we should certainly feel safe. And so identifying with someone by calling them their pronoun is a very strong sense of respect. Even if you can't support it, that alone shows respect and human dignity. Okay? And so as we continue this around support, I'll stay here just a little bit. We want to talk about what is that support and how do you support your colleague, and some of the ways that you can do it is just simply be respectful of boundaries, right? and respect their privacy. Don't gossip, especially if you were told something in confidence, either as a friend or because you are in leadership and they told you, particularly if you're in leadership and they told you. Don't gossip. Just ask, and do not make assumptions. And lastly, do not judge. Do not judge. Acknowledge the mistakes, right? If you misuse a pronoun, apologize and move forward. Make a note to use the correct pronoun or name in the future, right? And it may take some adjustment. Ask for patience, right? Say that this is, for some folks, I've known this is new to me. I'm really struggling with this, but I want to get it right because you matter to me. I can almost assure you the person on the receiving end, while yet it could be, a bit painful while you adjust, it is greatly appreciated that you're willing to make the adjustment, right? For their safety and for their own sense of identity, right? And so apologize, make it quick, move forward, contribute to a healthy system, model and speak up and educate yourselves, really, and support, create trans inclusive policies that are non-gendered, like bathrooms, non-gendered dress codes, etc. So in this space, when someone comes in the office and say Bob comes in the office and Bob, although male presenting, has on high heels, everyone doesn't stop to make it a big ado. But instead, we're continuing right on the day. Hey, Bob, how are you doing today? Now, I know that this is obviously somewhat of a fairy tale that we could do that, but I do believe that fairy tales do become reality. I absolutely believe that, right? And so I believe that there is a space that we could get to where that is norm, because after all, in those spaces, like where Bob wear high heels, we think back a few hundred years ago, that was our lived reality. It's just that now it isn't. So how can, again, we create this new narrative that showcases support without it having to be pointed out that I support you, right? Because then that can be a space of contention and awkwardness, right? That makes me feel like, okay, well, I feel safe, but I don't want to be the object of attention, right? Because that's not what support is, right? We don't want that. And recognize that they may not feel safe. And this can be a scary process, and they may feel alone or judged by family or loved ones or friends or people at work. Do what you can to support them. And then lastly, we talk about employee resource groups. And I love to talk about employee resource groups simply because I believe that employee resource groups in the workplace are a great catalyst for change. Oftentimes, we are waiting for leaders to change our workspaces, and literally our leaders need us to go in and change workspaces. I've been in positions of leadership, and I've been in positions of just associateship, right, where I've worked. And I'll tell you something, I've seen more associates make lasting change than I have seen leaders. And I'll just be very honest with you, and that's my lived experience as a professional. Even now, where I'm in mid-management because I'm in a different career, I see more associates coming together in their ERGs, which is your employee resource groups, by the way. I recognize that I'm acronyming them, to bring about change that eventually becomes policy. So supporting someone going through transition, really looks like, how can we connect around these universal things, right, of loss and joy and celebration, excitement? And here it's important to practice empathy and ask tons of questions, right? Recognize that it is a process that is unique for each individual, right? And ask, how can you support the person to do their jobs? Do they need to take time off? What about, this experience is challenging for them, work related, that is, right? As they transition from one space to the next. And again, I can't overstate this. Recognize that they may not feel safe. And it isn't always that you've done anything personally to create a space of unsafety, right? But there is a larger world that exists beyond the workspace that can trigger feelings of unsafety. That perhaps was something very small that the person may not even be able to identify that makes them feel unsafe. And so as we align to support this transition, we say, okay, how can I be of support? I think that's the most powerful question ever. And it doesn't have to be work related. I can tell you, if you sit down with your children, if you sit down with, or your parents or friends, after someone has explained their position on something, you ask, how can I be of support? It will open the door for you to engage a person in a way that they best feel safe and in a way that you can really become supportive. Okay, so let's talk through some scenarios, and you all can come off mute, to engage me with this. But let's talk through some of the scenarios. So you developed the PowerPoint training on supporting transgender and non-binary colleagues. You received feedback from your presentation that the pictures in the presentation include ones that seem to look like cisgendered people in heterosexual relationships. And this is a true story, by the way. What do you do? Do you make a complaint and say, why are they always complaining about, this is normal? Why are they complaining about the pictures being cisgender folks in heterosexual relationships? I mean, aren't they good enough for having like Pride days off? How dare you say that? Or would it be easier for you to just change the pictures, apologize, and don't become defensive? This is a situation where you have been given the gift of another's feedback in order to truly become better. But just as importantly, examine, why did you not catch this in your presentation? What about it allowed you to exist in a space of privilege, norm, that said, oh, this isn't inclusive? I say I believe in inclusivity, but this picture didn't demonstrate inclusivity. Or could I have simply just added more pictures that were inclusive, that demonstrated inclusivity, right? That offers you an opportunity to put on a new set of lens. And that's because you guys can see I wear glasses here. I love to tell folks, and particularly my clients, let's take a perspective lens. This is like this, where you have these glasses, you have transitional lenses. So when you go from one space to another, it's there to help you shield how you can see. Well, let's put on some perspective lens. And as we put on these perspective lenses, we have an opportunity to change and see things from another perspective that offers us an opportunity to grow and advance as well. Right? Well, oh, wow, I didn't catch that. I didn't realize that. I may have an internal bias. Or you know what? I may just be so privileged, and it's not a bias. I've been so privileged to see that as, the way I present, that it's normal, that I forget that, there is a world that exists beyond mine. And I want to include everyone, right? And that's good. Often prejudice and discrimination and harmful behaviors do not come from a place of negativity, and it's important to note that, but rather because they have become normalized and we just accept it, right? And just because it's normal doesn't mean it's healthy. It can really be difficult and scary for someone to be exposed to things that are diminishing, demeaning, harmful to them by nice people who don't mean any harm. And give those people feedback and risk rejection, defensiveness, and justification of the harmful things. Because if you're really nice, and I know you didn't mean any harm, it's hard to give you feedback. And if you become defensive in that space, it becomes even more challenging to give you feedback, because now I'm not sure, is it that you're not open to my feedback as it relates to your presentation? Are you not open to my feedback as it relates to the experience of the larger group that you are presenting to? Are you willfully remaining ignorant, just not sure what it could be? And that denotes an unhealthy environment. Okay, let's review another scenario. So you notice that a colleague has started wearing clothing that is more culturally feminine or masculine than they have in the past. And their personal style has also changed along these lines. You think that they may be non-binary or transgender and want to support them, including using proper pronouns. What do? Now, I know I said just a minute ago, so you guys don't have to feel like it's a trick question. Well, I would love to, so that we can just walk right past it as if, nothing happened with Bob and we don't even notice that the high heels are on. We're just kind of there. Do we bring attention to it? Do we criticize it? Or do we simply ask them, hey, I noticed that, there's been some changes in your style. What's up? And then if they share what they are, trans or non-binary, ask how can you support them? It's a very, very simple, clean, hey, I noticed some changes. What's going on? And maybe not what's going on in a way like you're peering into their business, but more like, hey, this is I've never seen you do this. This is a new trend. What caused this trend, or what allowed this? And what are you doing? Are you in entertaining modeling or something? Have fun with it sometimes. And I think in the spaces where when I say have fun, not that you all should cringe, like, oh, have fun asking someone about have fun with it in the sense of you're extending an invitation for someone to share with you who they are. We all know what this is like. If you're married, you've certainly done this. You've done this in courtships where you have, asked your wife or your husband or you're them or you're they out, and you've extended them an invite to share with you who they are based on how they're presented. Why should this be any different? It's not. We're only making it different, right? We're making it different because it falls outside of our norm. So then we need to otherize it so that then at least otherize has this neat little box that we could fit in, because at least I understand that that's the other pal. That's where all the things go that I don't really have the capacity to understand or want to understand. And what is clear about that is I don't care to understand and I don't want to understand. So that's the other. And that's just not healthy. And it's just not safe. All right, so let's review another scenario. You're sitting with a group of colleagues and one person remarks on a recent headline about a transgender woman. Another one, they are all over the place now, and he doesn't even look good in a dress. Some of the other people in the group laugh at the joke. Do you, A, do nothing, say it's just a joke? B, launch into a lecture on transphobia and tell your colleagues how hateful the comment was? C, state that you are uncomfortable with what was said and ask that your colleagues stop talking about transgender people in that manner and point out that the woman that was referred to was misgendered by the use of the wrong pronoun. D, you contact HR to discuss how this situation can be, addressed with organizational support. Or E, other, and the other being you say absolutely nothing, recognizing that you may not be the best person to present, right? Now I'll say this, doing nothing in the moment can be a valid option for a variety of reasons, including it's not an appropriate environment to have this discussion, right? You may feel like it's not safe to discuss for you to have, or for you to discuss this issue because of personal factors. You don't know how to respond respectfully until you've had a chance to really think about it. And, you may say, well, I'd rather hold. I'd rather hold because this dynamic doesn't feel good to me. If the dynamic of the group is one of respect, support, and openness, and healthily giving and receiving tough feedback, right? You may go for it. You may say just what he said, hey, you misgendered this person, and going forward, you want to, respectfully use the pronouns as they identify as, right? But oftentimes you may not do that. But I will tell you, in some spaces, each of these options are relevant. And each of these, minus the do nothing, it's just a joke. I want to be clear about that. Because again, if that's just a joke today, can you imagine how much worse the jokes are going to get by the time they come to your street? See, the funny thing about harm is it has a way of making its way to our front door when we ignore it at our neighbor's door. So make sure that if you are saying nothing in that moment, that you at least developing some sense of thought that you may be able to contribute, even if that looks like not saying nothing in the moment, but you are reporting it to HR so that organizationally, there could be some support, some changes. How can we develop some best practices that will really center around safety, cultural sensitivity, cultural competency that is around gender and identity. Very specific. Okay, and so I'll close with this, you all. As you think about this, I've left you with a few scenarios to really think about. I've given you some tools to be able to talk, and now we've come to the end of the presentation, and I'm happy to answer any questions that you all have at this time, but I want to share with you a little bit about Support Link and the services made available to you, because sometimes, you know, work and life just really become challenging. And whether we're talking about your sense of gender identity or a sense of expression or whatever it is, it could be depression, it could be anything. Support Link is here to support you and your entire family, because we simply know that life can just be too much at times. And if today you happen to be a member impacted by this presentation, you understand the critical need to feel supported and have support. Well, Support Link is here for that very reason. And these services are 100% confidential and they're 100% free. So no need to feel overwhelmed with a sense of non-support, because there is support for you. And I assure you, I've used my EAP and it worked very, very, very well for me. Okay, and so some of the services that are also included so that we can establish some work-life balance are legal consultation, financial consultation, identity theft consultation, dependent care referrals, which is the one I love most for those who have, you know, aging parents. And what does that look like? And then convenience referrals. Say you want to leave, you know, you and your family are going on a trip, and you're like, well, you know what? Fido doesn't have a place to stay. I don't know someone to take care of Fido. You can contact your EAP, and they'll help you locate someone to conveniently, you know, care for Fido by placing them in the kennel. All right. And then for anything else related to Support Link, you know, we want you to reach out and call the number 1-888-881-LINK. That is 1-888-881-5462, or you can visit online at www.supportlink.com. And I hope that you guys have found this training on supporting trans and non-binary colleagues very, very helpful. That concludes our session for today. And now I'll come back in so that if there are any questions, I can begin to answer them. Angela, are you with me?
I am, and thank you so much for that very informative presentation. I'm not seeing any questions, but we will leave it up for another minute or two in case some people are typing. But again, thank you, Mondero, for that great presentation.
You're most welcome. You're most welcome. Thank you. And if questions come in later, feel free to forward them to me as well.
Okay, great. We will be sending out a follow-up email that will include the recording. We can put Mondero's email in there, or if you want to email us, we'll forward it on to him along with the slides as well. So look for that in the upcoming days.
Absolutely, absolutely. Thank you so much. I see people coming into the chat now.
Yes, a lot of thank you. So looks like it was very appreciated.
Yes, yes.
All right. Well, if there's, oh, it looks like we got one question in the chat box.
Let's see here. Going through. Oh, can you share your nephews and yours all included statement again? Thank you for your time. Oh, you have to catch me when I was talking about it. I know what you were saying, this statement for my nephew and I. Oh God, I was just saying it just that fast. See? My nephew's only 9 years old, by the way. We have quite a few sayings. I don't know what I said. I would have to really go back because I was in the moment. Forgive me when I presented, I'm really in the moment. I don't know what that was.
It will be in the recording, so.
Yeah, if someone could remind me, I'm happy to share with you exactly which one, because he and I have like, I don't know, quite a few of them. I mean, literally quite a few.
All right. Well, I think that is it then. So again, thank you, Mondero. Thank you everyone for listening in. We will.
Good deal. Thank you so very much. And you have a great day on purpose.
Yeah, thank you.
You're welcome. Bye-bye.